Okay, I think we will give it a start. Welcome, everyone, to this Friday Awards webinar. My name is Charlotte. I work with the PPMA, and so glad to have you all here today. Thank you so much for joining us in your Friday lunchtime. I'm joined by Adele Henry from the London Borough of Islington, who is here to talk about their winning entry for the Best Employer and Trade Union Employee Partnership, which they won at our conference and awards in April this year, which feels like quite a while ago now, I'm sure, Adele. I know that you've got some of your colleagues in the chat as well who were involved in the winning entry. So I'm going to pass over to Adele, and yeah, I will be able to sort of help with any Q&A at the end. If anybody has any questions while Adele is talking, please just pop them in the chat and we will get to them at the end. Over to you, Adele.
Thank you, Charlotte, and good afternoon, everyone. So let me just share my screen with you. So hopefully that's come up. Great. Okay. So my name is Adele Henry. I'm the Diversity, Inclusion and Engagement Lead in the London Borough of Islington. And my team are based within our organisational development and HR service. And we oversee our equity, equality, diversity and inclusion, health and wellbeing, HR projects and policy across the council. So today, as Laura said, I'm here to present to you about our successful submission for the Best Employer Trade Union Employee Partnership Award. And following our previous and continuing work together with our staff and trade unions, we are continuing to work together to improve the experiences of our staff with disabilities. So next slide. So just to give you a bit of background, we wanted to make sure that we were really grounded in having some evidence and data to support this piece of work. And this took place a few years ago now in terms of where it started. So we launched our Challenging Inequality programme back in 2020. And at the time, that was during the global context of COVID, the Me Too movement, the murder of George Floyd. And overall, there was just a sense of a greater awareness and activism around equality for all protected characteristics and beyond that. So our Challenging Inequality programme was launched in Islington, and we sought to utilise that spotlight to bring to the forefront issues around inequality, racism, and injustice. And it meant that we were looking at this in a different way. We were talking about it. There was lots of dialogue, and we wanted to approach it with a whole organisation strategy to increase understanding and have a targeted, active sort of response across the whole borough. So what that meant was our framework for challenging inequality was designed to go beyond just our public sector equality duty and take a stand by leading in our position as a strategic leader in the borough, as an employer of approximately 5,500 employees, and also as a service provider to our residents. So we wanted to make sure those three key areas, being a strategic leader, being an employer, and being a service provider, those three key strands really stood out in our Challenging Inequality programme and were resourced and delivered as part of this wider action plan. So our HR and OD team led on the employer strand of work, and that was all about how we support our workforce and focus on improving equity, equality, inclusion, and diversity. And we needed to make sure that the work that we did, particularly in this space, was led by our data to inform the actions that we were to deliver on to support our staff. So in terms of disability, we knew in 2021, when we conducted a whole organisation staff survey, that there were high levels of engagement overall, but unfortunately, there was a notable difference between the experiences of staff who shared that they had a disability as part of that survey compared with the members of staff who didn't have a disability or didn't state they had one. So we also noted that within our workforce data, it suggested approximately 8% of employees had shared with us as an organisation that they had a disability. However, in that same staff survey, 18% of staff shared that they had a disability. So there was a real awareness at that point that there's less positive experiences and a lack of engagement amongst some of our disabled staff, alongside lots of staff not sharing or maybe not feeling able to share that they had a disability more formally as part of our HR data, and they were only sharing that as part of an anonymous staff survey. So we knew we had some work to do. In addition to that, we also had anecdotal feedback from staff suggesting improvements could be made to better support disability in the workplace. And also we had feedback and learning from employment tribunal cases and employee relations cases, which really indicated for us that there was some lack of expertise in this area, and also generally a lack of confidence in dealing with, in particular, workplace adjustments and being able to handle sensitive discussions and concerns about accessibility of our workplace. And this was also further compounded by the fact that at the time there was significant, and there continues to be significant, delays with access to work, which obviously impacts our ability to implement reasonable adjustments for colleagues across the organisation. So what we decided to do is we've got three key things here. So we utilised all of that data we gathered, including the feedback from our trade union branch officials, whom we meet with regularly as part of our collaborative effort to work together across HR with our trade unions, and also the workforce to ensure that staff can have access to the support they need in the workplace. And we also worked closely with our Disabled Staff Forum, which is a big network of colleagues across the organisation and who really champion disability and have a real strategic role in the organisation now. So we work together with them to establish a central disability and wellbeing post. This is the first time we had ever done this as an organisation, and actually we were one of the first in the country to establish a role that just focused solely on workplace disability and wellbeing issues. So the job description that was put together with input from our key stakeholders, including our Disabled Staff Forum, and the post has significantly improved the experience of our colleagues by reducing the timescales for reasonable adjustments, by providing that one-to-one support and being a key contact for colleagues across the organisation. And also it has meant that greater awareness has reduced the stigma around disability. People feel more comfortable to share, and also people don't feel a financial burden to maybe pay for their own reasonable adjustments, because they know they're entitled to that, where it's reasonable, of course, and they're not having to maybe buy bits of equipment themselves, which they may have done in the past. The second thing on there is around introduction of our disability working group. This was chaired by our corporate director of resources, which oversees our HR service. And this brought together key teams across the organisation. So from facilities to health and safety, HR colleagues, and also our future work team, which led on our work styles and hybrid working approach as well. So we also partnered on with the Business Disability Forum, and they were able to provide us with much needed and very helpful expertise and advice, particularly as we sought to achieve level 2 in the Disability Confidence Scheme. So this new approach has included a new process, as I've mentioned, for advising on and arranging workplace adjustments. We managed to secure, which was key to this, a central budget for equipment and licenses with agreement to fund adjustments where access to work would delay. And what that means is, instead of services independently having to fund reasonable adjustments for staff, and then it being an issue around staff feeling that their service may not be able to afford their adjustments, what we've been able to do is have a central budget that will fund all of the adjustments, and also a central process as well. And we're not waiting for access to work to fund and arrange reasonable adjustments. We are where we need to, we are doing that ourselves anyway. So in terms of our key programs of work, we have managed to implement a range of activity, and you can see on the screen there. So as part of our mission to create a more equal Islington, we wanted to empower our staff with disabilities. So this isn't just about reasonable adjustments. This is a wider program of work, including celebration and awareness raising as well. And so here are some examples of the work, which aligns with our organisation care values, which stands for collaborative, ambitious, resourceful, and empowering. And our improvements, if we just run through them, included strengthening our training offer for staff with the introduction of a disability awareness training, and also working with colleagues in public health services to deliver mental wellbeing training as well. A review of our recruitment and selection processes to strengthen the process and make it more fair for disabled candidates. For example, looking at our guaranteed interview scheme. We also designed a policy framework to support hybrid working. And as part of the hybrid working approach, we piloted, we were part of the pilot, working closely with colleagues in our future work programme, who were able to also have a think about how we even review language. So, for example, to avoid using ableist language in any of the materials that we publish as well. We have a challenging number of buildings across the borough. And I say challenging because some are listed. So there are real challenges in terms of building design and accessibility. But we were able to work with accessibility experts, Arup, and they were able to give us specialist advice and be part of a buildings review. And this included even things like sitting and standing desks, ensuring wheelchair accessibility of buildings, providing ergonomic equipment. And that's had a real impact because people can see, physically see the impact that's had in terms of modernization and improving people's experience as they come into the office more often now. There's still some way to go, but it's fair to say there has been a huge improvement, and that has been fed back to us. We also are ensuring our HR policies and learning content complies with web content accessibility guidelines and requirements. We have launched a Share Not Declare campaign, and that work is continuing to happen. So we want staff to be able to feel comfortable to share with us that they have a disability, so that we can support them, so that they're able to better do their work, and obviously therefore ensure there are better outcomes for our residents. And lastly, we have also consulted on and developed a neurodiversity toolkit as well. Just quickly, I'm conscious of time, but I'll run through some of the others on there. We introduced a sunflower lanyard scheme, which was championed by our Disabled Staff Forum. And this is to ensure that staff, maybe with non-visible or sometimes referred to as hidden disabilities, feel that they're able to be part of that scheme if they want to be. And actually, that's really been a popular thing across the organisation, and that you'll see there are lots of staff that do wear the sunflower lanyard scheme, lanyards, particularly when they're in the office. We've also delivered and refreshed our workplace passport, so staff can make sure they're not having to repeat anything about their disability, any sort of adjustments they might need if they, for example, have a new manager, or perhaps are successful in a new role in an organisation and they transfer to another team. And so that was something that we did collaboratively with our Disabled Staff Forum. And also in terms of in thinking about intersectionality, the forum were really keen to work with our other forums. So now that Workplace Passport has been updated, so carers and other staff, perhaps maybe who don't identify as being disabled but have other long-term needs, can also use our Workplace Passport. And that can include staff, for example, that are neurodivergent, are affected by menstruation, menopause, or people with mental ill health. So there's quite a large group of staff that are this would be applicable for. And we also want to celebrate disability. We don't want to make it a sort of hidden thing in the workplace. So we encourage staff to get involved, whether they are disabled or not, with a range of activity every year as part of UK Disability History Month. And that is upcoming. So we already have plans with our Disabled Staff Forum to deliver a range of sessions for all of our staff to get involved in as part of that, and to make sure that disability is something that we champion across the whole organisation as well. So some of our achievements. So in the first year, 121 staff were directly supported and benefited from the new centralised model for workplace adjustments. The majority were self-referrals. So what that means is the actual staff member themselves self-referred and contacted our disability and wellbeing officer. We do have a central inbox for people to get in touch around disability and wellbeing issues. And for people who were not directly self-referred, often you might find, for example, we have managers who may get in touch seeking advice and guidance from that particular post. So we felt that was a really good achievement, that we'd managed to reach out and provide that support to that many staff in the first year of the role being launched. The total investment in workplace adjustments was, to be exact, £89,744. So just shy of 90,000 investment in that first year. So what we were able to demonstrate is, as an organisation, we were really willing to invest in our staff who needed those reasonable adjustments to access work. Unfortunately, only £7,000 of that was is able to be reclaimed from access to work. But the council committed to acting swiftly, and frankly, we were not able to wait with the access to work delays. So we wanted to make sure that we could implement those reasonable adjustments for our workforce. But that has meant that we lost our eligibility to claim back some of those funds, or more of the funds. So overall, our waiting times for the implementation of reasonable adjustments were reduced. So on average, they were taking over 6 months prior to the Disability and Wellbeing Officer role being introduced. And we have to consider this varies significantly. So for some people, they might need, one piece of equipment to support them. And for others, they might need a whole range of equipment. That might be software, there may be training associated with that. So it can really vary. So the timescales can be slightly misleading in that sense, because it really is a case by case basis. But we went from, on average, over 6 months to an average of around 15 weeks for existing staff and 10 weeks for our new starters. And we are still working on obviously trying to reduce this time. And like I said, this does include waiting times for specialist items and assessments. And what we're trying to do to support the reduction of the wait time is have some centralised stock, which is now being established to ensure that for those frequent requests that come through quite often, we actually can have some stock in-house to reduce that. In addition to that, we have procured training. So we worked with our again, our Disability Staff Forum and colleagues in the organisation to have a pilot of training. around disability awareness. And following a successful pilot, we partnered with Disability Rights UK to deliver our disability confidence sessions to staff. And we're in the process of mandating that to ensure that as many staff as possible across our organisation have attended that training. And we've had some brilliant feedback, and we've had our trade union colleagues be part of that and giving us that positive feedback around it and attending themselves and encouraging their members to attend, which has been brilliant. Significant improvements have also been seen across our buildings, as I've mentioned before. So we've modernised, we've made fundamental changes to office design completely. There were more accessible meeting rooms. Our meeting rooms now have things like automatic doors to ensure independent access. And we also ensure that when people can book a room, the booking system has an accessibility symbol so that people can see what the room is like. They can actually have a visual idea of what the room is like, the layout, and if it is accessible. And following partnership work with our forums, we have committed to a further prototype pod with automatic sliding doors, and this is one of the first of its type in the country as well. So overall, this work has been a success, and it's largely due to the input and feedback from our staff, from our forums, and also from the trade union. So we have had really, really good feedback, and that relationship continues. So there are a couple of quotes there, one from the chair of our Disability Staff Forum, and also one there from our trade union branch official, just to give you an idea of some of the things that they have said about the work. And like I said, it's really an ongoing piece of work as well. So in terms of ongoing improvements, a recent research activity has explored opportunities for improving access to information and advice in order to develop a new disability information hub for our staff. Now, we know that we introduced a new role, but obviously as that role has become further embedded and a permanent fixture in the organisation, we've realised that there are lots of repeat issues, repeat concerns, obviously, that are flagged to our disability and wellbeing officer. And so what we are doing is ensuring that all of the bits of information that our staff are really wanting to find out about disability that can help them is easily accessible, and they can do that themselves by looking at things up on our disability information hub. So it's very much a work in progress. There's lots of things on there, but sections include, condition-specific information. It's, inclusive information about inclusive language and communication, the process for how to request workplace adjustments with examples of what those adjustments might be, information about our workplace passport, and also the available training. And this hub was really a collaboration between HR, health and safety, our staff forums and trade unions. The common topics that staff who were consulted with as part of this piece of work were things like 75% were interested in reasonable adjustments, 46% were interested in mental health and neurodiversity, and 25% were interested in disability-related sickness. So these are key things that you might be similar across your organisations as well. The hub uses the social model of disability to establish the tone and language across the different pages, and it provides equal access for all staff. So anyone across the organisation can access it. And we also want it to continue to grow. So staff can continue to self-serve and find out information for themselves about disability and how best to support themselves, colleagues, and staff they may line manage as well. So in terms of organisational commitments, we know that all of our work is linked to our wider organisational objectives and our mission to be a council of fairness. It also aligns with our Islington Together plans and our promise to continue to tackle inequality moving forward. And this is also a key part of our workforce strategy, where our key strands of work are around employee experience, equity, equality, diversity, inclusion, wellbeing and resilience, staff development and organisational development. And just lastly, I'd just like to give an acknowledgement here to our Disability and Wellbeing Officer who continues to be a consultant in this area of work and is on the call and led on a lot of this work. So I will not take the credit. Laura has done a brilliant job of rolling a lot of these schemes out across the organisation. So thank you for listening. And I will stop sharing. And if anyone has any quick questions, you're welcome to pop them in the chat.
Thank you so much, Adele. That was wonderful, and obviously a lovely shout out for Laura at the end there, who is also on our call. Thank you so much. Let me just um add both of us. There we are. So I have had one question through which was sent as a direct message. So I'm going to relay that to you if that's okay, Adele. So it's from Valentina. So she has asked, how is the take up of Workforce Passport? Is it digital on the HR system? Our experience has been one of low take up. There you are.
Should I go ahead so at the moment we haven't had a formal sort of on the HR system an approach where we formally put it on there. So staff can formally announce that they have a disability that can be put on the system, and that's something they can have as part of add to their profile. But in terms of the workplace passport itself, it is not part of like a database or something like that. It's really something that we encourage people to fill out with support of their line manager, or they can get in touch with the team if they would like advice and guidance around completing it, and then have that discussion with their line manager around what adjustments they might need, if any, because obviously some people don't. So we don't actually hold a collective record or number of how many people need workplace adjustments. Sorry, a workplace passport. Apologies. And actually, there's something about, I guess, when we want to hold data, what would that number tell us? Why would we need to know the details of people's workplace passports? Obviously, we have a wide range of reasons that people use a workplace passport. It could be menopause, it could be caring responsibilities. So for us as an organisation, when we collect data, we want to make sure it's purposeful and it's not just sitting on a database. So it's not that I would be against holding that information, but I guess it's also about building trust with our staff. And I think they would probably say, well, why do we need to formally log it with HR? And it's something, I guess there are pros and cons. And maybe some people like the idea of being able to say, oh, well, we know 1,000 people have used our workplace passport. But yeah, I think it's about being purposeful when we're looking at data. So we haven't chosen to do that, but that's not to say that we wouldn't in future.
Okay, brilliant. Thank you. I hope that answers your question, Valentina. I will open the I will open the floor up to any more questions in the chat or any sort of hands up. Obviously, feel free to ask Adele any more questions. Obviously, I'm sure that if there's sort of any questions after the webinar is over, Adele won't mind you getting in contact with any more questions that anybody might have. But I think that looks like everything at the moment. So just a sort of a bit of a close from me and a big congratulations and thank you to Adele and her colleague Laura for being on the call today and sharing their amazing work with us. Obviously, we can all see what deserving winners you were, and hopefully looking forward to seeing you again at the conference next year in April. And obviously everybody on the chat as well. Our conference dates have now been announced, so it'd be great to see you all there and be able to celebrate such amazing winners such as Adele and Laura at Islington. And thank you so much for coming to today's webinar.
Thank you.